Hello, and today we'll be discussing one more bone. So this is the humerus, and that forms the skeleton of arm, or what we call as a brachium. And in case of the animals, the direction of this bone is basically obliquely downwards and backwards. So if you consider this side as head and this side as tail, so the direction of this bone is like this. So this forms obliquely downwards and the backwards direction of the humerus, because on its proximal side you will have the articulation with that of one more bone. So this bone is the scapula. So this is the scapula. So direction of the scapula basically is obliquely downwards and forwards. So this is the direction of the scapula, and this is the direction of the humerus. So this is how we can direct the bone in case of the animals. To which side this will belong, that will be in this lecture, how we will identify to which side this will belong. So usually this bone is a long bone having the shaft and the two ends, and this shaft, if you see in a general, if you see this shaft, this is irregular cylindrical, not a complete cylinder. It is irregularly cylindrical, having four surfaces. One of the surface we can see is this. So this is one of the surface. So this is the lateral surface, and lateral surface is always spirally twisted. So spiral groove here, what we call as a musculospiral groove, where there will be the presence of the brachialis muscle. This is always on the lateral aspect. So if you want to put this bone in an animal in the direction of obliquely downwards and backwards, put this side as outward side, as a lateral side, having the musculospiral groove. Accordingly, you can say that this bone basically, which is here, belongs to the right side. So this side will be outer side on the right aspect, and this bone will be on the right. So on this basis of the musculospiral groove, which is highly spiral on the lateral aspect, you can decide to which side this will belong. So in this musculospiral groove, you will have a muscle, what we call as a brachialis muscle. So this is musculospiral groove where the brachialis muscle will be present. So the opposite surface of this is here. So if we turn this bone, so this is the medial surface, and medial surface is somewhat straight surface. Almost at the center you will have one tuberosity here. This is called as a teres major tuberosity, and to this teres major tuberosity you will have the attachment of the latissimus dorsi and teres major muscle. So this is the medial surface, and that one is the lateral surface. To the cranial surface, so if this is lateral, so this is become the cranial. So the cranial surface you see here, so it starts very wide. So the cranial surface is very wide at the beginning, then it narrows down. So very wide and triangular, almost triangular in outline, the cranial surface, then it narrows down, narrows here. And if you see here at the distal end of this cranial surface, distal end, it is very somewhat rough, and to this roughness, you will have the attachment of one more muscle, that is a coracobrachialis muscle. So the coracobrachialis muscle will be attached here. Here on the medial aspect it will be teres major muscle and latissimus dorsi, and on the lateral aspect in this musculospiral groove you will have brachialis muscle. So the fourth surface, so this is lateral, this is cranial, this is medial, and this becomes the caudal surface. So the caudal surface, if you see, it is somewhat rounded in appearance, and this surface ends in a one deep fossa, what we call as olecranon fossa, and in this olecranon fossa there will be articulating the olecranon process of the ulna, when there will be the formation of the elbow joint. So these are the four surfaces that are present in this type of bone. Besides the lateral surface and this what we call as the cranial surface are separated by one crest. If you see here, there is a one crest here that is separating these two surfaces. So one crest is here, This crest separates the lateral surface and the cranial surface. This is called as a humeral crest, and to this humeral crest there will be the insertion of brachiocephalic muscle and superficial pectoral muscle. So you can find brachiocephalic muscle and superficial pectoral muscle will be inserting here. And just towards the proximal side of this crest, you will find one tuberosity here, an elevated area here, what you call as a deltoid tuberosity. And to this deltoid tuberosity, the deltoid muscle will be attached here. So this is deltoid tuberosity. And from the deltoid tuberosity, if you look closely, from the deltoid tuberosity, a curved line is going upwards and backwards. This line, so a curved line is going upwards and backwards. So this line I mean to say. So this is the line, this is the deltoid tuberosity, and the line is going upwards and the backwards, and this line is called as a tricipital line. So this is the tricipital line that is going from the deltoid tuberosity upwards and the backwards, and to this there will be the attachment of the lateral head of the triceps brachii muscle. So on this curved line, and in this curved line we will find a small tubercle here. This is a teres minor tubercle, and to this teres minor tuberosity you will have the attachment of the teres minor muscle. So deltoid tuberosity, tricipital line, teres minor tuberosity where the attachment of teres minor muscle will be attached, and this is the humeral crest. This is the humeral crest that is separating this surface, highly spirally twisted surface, lateral surface, from that of the cranial surface. Coming to its proximal extremity of the humerus. So the proximal extremity of the humerus basically has head. So this is the head of the humerus. Then this is the greater tubercle, and this is the lesser tubercle. So you will have the head, greater tubercle, lesser tubercle. Then you have this groove that is separating these tubercle, greater tubercle and lesser tubercle. You will have this groove, this is called the bicipital groove. Then you have the short constricted portion here. This is called as the neck of the humerus. So the head, neck, greater tubercle and the lesser tubercle, and these two tubercles are separated by this bicipital groove. So this greater tubercle is itself divided in two parts. One is this part and one is this part. If you look out this part, this is somewhat convex in outline. So this is called as convexity, and this is called as a summit. And if you see the direction of the summit, it goes somewhat towards the bicipital groove. So it goes towards the bicipital groove. So this overhangs or forms a roof on the bicipital groove. Itself, this smaller tubercle is divided in two parts. One is this cranial part, one is this caudal part. So the proximal extremity divided into having the features of head, neck, greater tubercle, lesser tubercle, and the bicipital groove. And this, what you call as the summit, usually forms the point of shoulder in case of animals. So this is the point of shoulder in case of animals, and to this summit you will have the attachment of the lateral tendon of supraspinatus muscle here. So lateral tendon of supraspinatus muscle will be here, and then just here there is a roughness here, just underneath of this summit you will have the roughness here, and to this roughness there will be the attachment of long tendon of infraspinatus muscle. So long tendon of infraspinatus muscle will be here, and greater tendon of supraspinatus muscle will be on the summit. And to the convexity here, so this is the convexity. To the convexity there will be the attachment of the short tendon of infraspinatus muscle. So short tendon of infraspinatus muscle will be here, and this is the lesser tubercle. Two parts, one is the cranial part, one is the caudal part. And to the cranial part there will be the attachment of the medial tendon of supraspinatus or deep pectoral muscle, and to the caudal part there will be the attachment of subscapularis muscle. So this is how these muscles are attached to these different parts on the proximal side. And if you see the bicipital groove here, so the bicipital groove usually that is formed, the boundaries of the bicipital groove is usually formed by the summit and by the cranial part of the lesser tubercle. And in this bicipital groove, you will have the origin of tendon of biceps brachii muscle. So from here, there will be the origin of tendon of biceps brachii muscle. Coming to the distal extremity. So the distal extremity is this. So the distal extremity basically has oblique articular areas. You will see this oblique articular area divided by this ridge. So this is one articular area, and this is other articular area, and this is ridge. And these articular areas are for the articulation of these articular areas, what you call as the condyles. So this condyle is bigger as compared to this condyle. So this is a medial condyle, this is a lateral condyle. If you see, this is the lateral surface and this is the lateral condyle. This is the medial surface and this is the medial condyle. By this also you can identify this bone to which side this will belong. And the medial condyle is always bigger as compared to that of lateral condyle, separated by the sagittal ridge. And if you see here, there is a one depression, one shallow depression that is going from this medial condyle to the backwards, and the backwards you will have on this fossa, deep fossa, that's called olecranon fossa. But just above this, above these articular areas, you will find one more shallow depression here. This is called as the coronoid fossa, to which the coronoid process of radius at the extreme flexion will fit here. So this is coronoid fossa where the coronoid process of radius will fit, and backwards you will have the olecranon fossa. Then on the back side where there is a presence of the olecranon fossa, so this is the olecranon fossa, and where the olecranon process or the enconis process will fit at the extreme extension, and the boundaries of these olecranon fossa, you will have the origin of enconis muscle. So here will be the enconis muscle, and this olecranon fossa basically is bounded by two epicondyles. This one epicondyle, this other epicondyle, one will be the medial epicondyle, one is the lateral epicondyles. You can see here, two epicondyles are there, and these epicondyles, you will have you will have the origin of some of the muscles from the medial epicondyle. So this is the medial epicondyle. You will have the origin of pronator teres. You will have the origin of flexor carpi, ulnaris, and you will have the origin of superficial flexor. So all the flexors will be on the medial aspect, on the medial epicondyle, and extensors will be here on the lateral epicondyles. You will have extensor carpi radialis, you have ulnaris lateralis, you have lateral collateral ligament of elbow. So extensors will be on the lateral epicondyle, flexors will be on the medial epicondyle, because when you see the radius and ulna, usually the extensors will come on the cranial surface and the flexors will come on the caudal surface. So these are some of the features of humerus of ox. The comparative you can see in case of in other animals in other video. Thank you.